So, why do we pay attention to suicide? Because this is unexpected, unforeseen, and it is not something that is planned. And especially in the recent years, the depression symptoms just going introvert, being just closing down, is also there's an increase in harming children themselves. So for that reason, we just took such a subject to discuss about. And the completed suicides are more than the incomplete ones. Actually, it's only the case how we can intervene with the completed ones, incomplete ones. And of course, the incomplete ones are actually mild cases. At least they are not in severe condition. So then we examine that. Of course, in the background, there are really severe conditions. I will give some information about my own from my patients. And I think that they will be also contributing to this presentation. For example, in 2017, in 100,000 children, can you just turn on the previous slide? In 100,000 children between 10 to 17 years of age, 100,000 adolescents were intended for suicide, and these are really high numbers, and we can skip this. And what are the risk factors for suicide? One of them is the depressive symptoms, especially the depressive symptoms in the child, as well as the first degree relations, and also the intentions of the suicides of the family members, as well as the genetic predisposition, increases the risk for suicide. So if we hear a story from our close surrounding, it may be a friend in the classroom, or it can be an episode in the social media, or an story, they may be triggering the thoughts for suicide. So these sharings and exchanges are important for protection of the suicide. And once again, with the depression in the families, there are some personal characteristics which trigger the suicides. Of course, in adolescent suicides, there's something different. There is impulsivity. For example, we see that there is an clash or a fight in the family. Then what happens that then these adults followed such a way, and this is one of the things that we are feared. If this is something planned, then could be foreseen. You can create a way for this. But if it is impulsive, then we have a very low rate or probability of preventing the suicide. So I ask whether there's a probability of correcting or doing good things in life. So depression can be fixed, or the
So it's one of the specific areas of the psychiatry, and for there are some traits that has a tendency for suicidal attempts, like the impulsivity, for example, without thinking of the consequences, and looking for the excitement lack of perseverance, and they have an emotional tendency to urgency. They want to solve it without planning, without organization, and it can be mentioned as the impulsivity.
Duygusal dürtüsellikten bahsediyor. Affective impulsivity. Son zamanlarda özellikle bu intiharla ilişkili en
Affective impulsivity is also related, one of the related concepts to suicidal attempts. So these are the negative urgency. These could be depressive symptoms, borderline personality disorder symptoms, or impulse control disorders. When we think of the suicide, some think that when they come to the polyclinic, they're not maybe suicidal attempts, but self-damage maybe you can. And these should be separated, discriminated, because their prognoses are different. In the emergency cases, when they are examined, did they want to commit suicide when they're cutting their wrists, or if they just were trying to do this in order to show the parents that, a lesson to the parents maybe. And so depression, personality disorders, and impulsive responses. For example, maybe ADHD can be in it, or bipolar mood disorders, or bullying, especially in adolescents, or the personality disorders. If the child is bullied, maybe it's because of the gender problem. So they all should be taken into consideration. So emotional impulsivity is associated with different suicide behaviors. Why are they important? For example, in some schools, there are some scanning studies in schools about suicide, because we're trying to be proactive for that. But about adolescents, maybe there should be some more interventions for that as well. Their depressive symptoms or their impulsivity, if they could be measured previously, then maybe they could be intervened or they could be dealt with. And I'd like to talk about one case. It was one of the striking cases in my child psychology ward. It was the sibling of a person who committed suicide, a child who committed suicide. And the suicidal ages are really lower, but when we were children, or students or residents, the age went down to like the 12, 13. And why is it so early, and what are the risk factors? And they are the topics of many studies, but I think social media plays an important role in this. For example, at 3 in the morning, eighth grade boy, and the parents were divorced, and he posted something on Facebook, and then the cousin who saw that let the uncle know, and when they came into the room, they saw the dead body of the child who threw himself from the 6th floor. So an 8th grade child, he's looking for the meaning of life. I have seen the life, and I couldn't find anything that I was looking for. So they're looking for the meaning of life. Or so are we just not doing anything for them, or aren't we giving any responsibilities to them, or do they have a lot of burdens on their shoulders? So what is causing that? So what is the role of the social media, and what kind of friendship relations are effective on that, or religious topics? For example, when we were talking to the child, belief, he said that I don't believe. So can it be a suicidal factor in that? And after 2 years, I'm still following up this child, and we have to take all of these into consideration. And thank you very much.